Hello, my name is Miki Clements. I'm a registered nurse in the RN to BSN program. This presentation is Nursing Informatics Competency Project, and this is for Nurse 479 Nursing Informatics at Texas Lutheran University. The contents of this presentation will include a self-assessment of my own competencies. I've utilized the patch scale, the QSEN competencies, as well as reflection on my own personal work experience. I will also discuss integration of competency in nursing, specifically how these competencies relate to my role as a clinical quality specialist. And finally, I will review my professional development plan. I will go over how I intend to attain the competencies that are needed and my continuing education plan to ensure that once I attain them, I maintain them. I completed the online PATCH assessment scale. PATCH stands for Pretest for Attitudes Toward Computers in Healthcare, and my results yielded a score of 86 out of 100. Essentially, that means that I am very strong with the computer in terms of how it is utilized in healthcare. According to the interpretation of the quiz, it states that I'm very confident that I can learn to use a computer to boost creativity and perform routine functions. I would agree with that and actually state that I do feel more comfortable using the computer when doing writing and other creative activities. I also use it for a lot of routine functions such as taking notes and making lists and things of that nature. The results also state that a user with this score recognizes the unique value of using information technology in society, and I do agree with that and identify with that for myself. I also identify with that in nursing. There's a lot of value in using IT in healthcare for many purposes, and I'll go into that a little bit on the next slide. And lastly, it states that there's an idealistic and positive view related to computer applications in healthcare, and I absolutely concur with that and see a great deal of value in the integration of technology into how we care for patients. This slide shows the PATCH assessment scale scoring interpretation, and it shows the range of results from the lowest category all the way to the highest. And while technically I did not score in the highest category because my quiz score was an 86, it's odd to me that the description that was generated on the previous slide corresponds to the highest level score of 87 to 100. But either way, I agree with the results based on review of the scoring and the interpretation. I was able to download the printable version and look at it so that you can see how each question is scored and how it's rated. I do feel like I am a big proponent of the incorporation of technology at the bedside, and it's important to me that more clinicians, both inclusive of nursing and all other disciplines on the clinical care team, become early adopters of new and advanced technology. There are many new programs and applications that are out there that aim to better include patients in engagement in their care, and the more that patients are active and engaged in their disease process and their health maintenance when they're outside of the hospital and outside of our care, the more engaged and compliant they are likely to be while they are in our care in the hospital setting or in the clinical care setting. I also evaluated myself based on the competencies as outlined by QSEN, which stands for the Quality and Safety Education for Nurses project. QSEN has addressed how to best prepare future nurses with the knowledge, skills, and attitudes necessary to continuously improve the quality and safety of healthcare systems. And this is an integral part of the uprising of nursing informatics. I recall when I first came into practice 8 years ago, and while my hospital that I started working in was completely up and running on an electronic medical record, there were many other hospitals within my healthcare system that were still documenting everything on paper, and there were others that were hybrid, in which they had both electronic documentation as well as paper charting. I think that QSIN has aimed to bridge those gaps, but also to raise nurses, so to speak, with the knowledge of what technology looks like in healthcare, the skills on how to utilize that technology, and the attitudes so that they are open and engaged. I feel it's critical for healthcare workers to have a positive attitude about the utilization of technology in healthcare, because it really is at the forefront of how we engage our patients. This is sort of the new frontier, so to speak, and this is where healthcare is moving, both in terms of how patients access their information and stay in the loop on their care plan when they're outside of the hospital, as well as how clinicians utilize that information that is available to them while the patient is in the hospital or the clinical care setting. So QSIN is a great initiative to address those different elements, and I feel as it relates to my own self-assessment, I have come a very long way in changing my attitude from seeing electronic medical record documentation as a hindrance to now seeing it as a huge benefit, that it's hard to look back and recall what we ever did without it. In addition to the competency assessment tools that are provided on eRacer, I have also completed a self-assessment of my professional work experience in nursing informatics. My experience consists of serving as an electronic medical record super user or expert for about 2 years while I was in my bedside nursing role. Additionally, I held a formal position as a clinical informatics specialist for about 18 months, in which I supported 3 sites within my health system and worked on and supported several network level projects. And additionally, I maintain my organizational affiliate membership with HIMSS, which is Healthcare Information and Management Systems Society. This enables me to maintain up-to-date information about what's going on in informatics around the nation. As part of my attempt to connect my professional goals and the essential informatics competencies that are needed to achieve that role, I thought it would be helpful to review my position so that you have a better understanding of my role and the work that I do. So, as a clinical quality specialist, one of my key roles is to conduct in-depth chart reviews when evaluating patient safety events or looking at a situation that might have resulted in an adverse outcome to a patient. After doing that, I am tasked with identifying any gaps in process or documentation that may have existed, or identifying any deviations from the timely delivery of quality care. That entails ensuring that various standards are met, and really refers back to various things such as policy and practice guidelines, as well as various regulatory and other types of requirements that hospitals must follow. And then finally, when addressing any of those gaps that are identified, my role is to partner with a multidisciplinary team to help identify the root causes that led to those opportunities and help eliminate any gaps that may have occurred. And we utilize the ideals of process improvement in my facility We have a fairly stringent process that we follow when we're doing PI work. And when I was doing my literature review, I tried to focus it on aspects of informatics competencies that could help me to be more successful in my role. Using the TLU library database, I searched CINAHL and ProQuest Nursing and Allied Health databases to search for articles that would help me to incorporate the informatics competencies that I've chosen to focus on into my professional setting that I currently work in. The first article that I found was utilizing the search terms quality, informatics, and competency. And I found an article by Melnick, Gallagher Ford, Long, and Fineout Overholt that essentially outlined the importance of incorporating evidence-based practice competencies into healthcare systems, and that doing so should lead to higher quality of care, greater reliability, improved patient outcomes, as well as reduced cost for facilities. This incorporates nicely into my work because I monitor for all of those things in my job as a quality specialist. The second article that I researched was by Meyer, Moran, Kuvar, and Carlson, and this one was related to how state boards of nursing can be a bridge to quality. This was largely based on the implementation of competency requirements, which many are not in favor of. Competencies for nurses on how electronic medical records are used are important to build a model of accountability, according to these authors, and they are necessary to fully achieve partnership among the interdisciplinary care team to ultimately improve the care that we give to our patients. But it was cited in the article that not all state boards of nursing are on board with this, and there again is much discussion about whether or not this is appropriate. For some people, I got the feeling that it feels too regulatory or too controlled. Nurses don't like being told that they have to document in a computer system, but this really outlines going forward and in the future how important EMR really is in the healthcare setting, and perhaps we do want to move in that direction. The third article that I researched was by Sherwood and Zomarty, and this one really hit on the engagement from nurses with how EMR is used and how it can really help to improve the culture of safety and continuously improve the care setting, so that ultimately nurses are delivering higher quality care. It also addresses that education is important to garner support for the nursing focus on quality and safety, particularly for nurses who have been in practice for some time. This is really about sort of shifting the mindset of existing nurses and getting them to see that it's not just about how you care for your patients at the moment during the time that they're here within our four walls, but it's very much about the outcomes that our patients have long term, and their engagement in their disease process sort of throughout the continuum of their lives. The professional nursing organization that I selected to highlight in this presentation is, I guess, technically not just a nursing organization. It's AHRQ, which is the Agency for Healthcare Research and Quality. It is a broad, all-encompassing healthcare quality organization that does include nurses at multiple levels throughout the organization. And their primary mission statement is on this slide, and it reads, quote, "The Agency for Healthcare Research and Quality's mission is to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, and to work within the U.S. Department of Health and Human Services and with other partners to make sure that the evidence is understood and used," end quote. My professional goal to bring into my current quality role is my background as an RN providing direct patient care and the work that I've done in clinical informatics in the past to help make healthcare safer and to produce quality outcomes for all patients that my institution serves, as well as to design processes that foster success for clinicians to adequately capture and reflect the care that they give to their patients. Ultimately, my goal as a process and performance improvement specialist is to make it easier for clinicians to do the right thing and to do so with evidence-based practice guiding those improvements. As I think about my professional development plan, I want to tie in all the various competencies from QSIN as well as the patch assessment to show how that will work or will help me to be more effective in my professional role as a quality specialist. So as part of my plan for this, I hope to enhance my knowledge by contrasting the benefits and limitations that certain technologies offer and how those can impact and improve patient safety and quality. Part of that QSIN knowledge competency also entails engaging staff and patients in new initiatives and getting them engaged in wanting to utilize that. The second competency-based goal that I have is to expand my skills using an evidence-based approach in how I move forward in any PI work that I manage. I will achieve this by incorporating current peer-reviewed literature found in relevant library databases, and as I'm currently doing, I will continue to use information management tools, reports, and databases and things of that nature to monitor our patient outcomes and to drive future PI work that we do at my facility. And lastly, I will address the QSIN attitudes competency by ensuring that any proposed changes or technical enhancements that are made to our EMR always include the end user in the design and that our frontline staff are part of that decision-making process. Also, I will model a positive attitude by being an early adopter of new initiatives at my site. And I think it's also important to think about attitude with how we as clinicians think about education as being a lifelong process. It's one thing for us to learn something one time and file it away. It's another for us to learn something and incorporate that into our practice and use it and teach it to others as well. So really I think that these competencies will serve as a solid foundation for me in my role, and I look forward to implementing them.